Hello everyone, my name is Moyet Francis. I'm a registered nurse here at Silvercrest Nursing and Rehabilitation Center and a student of Grand Canyon University where I am in pursuit of my MSN degree in Leadership and Management. I'm here to present to you the SBAR communication, a new yet promising mean of communication among all healthcare providers. SBAR is a mean of communication that is used to highlight immediate change in patient condition to prevent avoidable hospital transfer. As we all know, at Silvercrest, the adverse effect of hospital transfer has taken a toll on the facility due to the decrease in revenue, reimbursement, and overall resident prognosis in terms of of care and rehabilitation. To examine this, we have to have a need for change. There is an increase in hospital transfer and subsequently discharges due to no bed hold policy at the facility. There is also a delay or ineffective resident change in communication among the healthcare provider, which leads to untimely treatment and predisposes transfer of resident to acute care. With this, it has reduced revenue and Medicare reimbursement, which is also associated with a hospital transfer. There is a competitive factor of healthcare facility that may become a preference of those transfer resident, which adds to the possibility that resident may not return to the facility. There's also interruption in the continuum of care. When residents are hospitalized, and this affects their rehabilitation as well as the patients on vent, it delay their weaning. Vent patient has to start all over and rehab patient have interruption that create issues leading to delay in recovery. The predisposed solution for tackling this issue is to introduce SBAR communication to healthcare providers and other facilities employers so that they can effectively and timely communicate residents' change and condition to prevent or reduce avoidable hospital transfer. The mission of Silvercrest is the mission statement of Silvercrest is giving quality to life. This statement correlates with the strategic goal to reduce and avoid hospitalization by communicating resident change through SBAR documentation. The SBAR initiative will significantly influence quality of resident care by facilitating timely assessment and holistic care. What is SBAR? SBAR included in the template a brief synopsis of what's going on with the patient. Situation. What's going on with the patient? Background. What is the patient background? Assessment. What do I think is the issue? Recommendation. What should I do? Respond. Final outcome that determines how SBAR is implemented. SBAR can aid in early identification of resident change in status. It facilitates a comprehensive resident assessment. It improves patient care documentation, enhances timely communication among healthcare providers about patient change of status. Graph on NYRAH QI 2017 highlights effectiveness of SBAR of avoiding hospitalization of residents in NY hospitals. The budgetary concerns of implementing SBAR is very low because the infrastructures are stuff are laptops, etc., that we already have in the facility. Therefore, it will be no cost to us to there will be little or no cost to us to implement it. The most cost will come from getting someone to teach the necessary people to learn how to use SBAR effectively. There's no additional hiring for this initiation. Therefore, it do help us to save money. SBAR implementation plan. During the implementation phase, the SBAR committee will establish a vision for SBAR communication among stakeholders and employees. Decision for a pilot study or facility-wide SBAR trial. You're going to educate and motivate all LK providers to adopt SBAR communication through facility template. Encourage optimal participation in SBAR template by formation feedback in service, unit meetings, webinars. Communicate throughout the facility and provide progress feedback to stakeholder. Program feedback to stakeholder. You're going to measure success periodically and evaluate this SBAR initiative is critical to determine success and goal, accomplishment and template effectiveness. Therefore, periodic SBAR audit can determine how initiatives are performing in terms of reducing avoidable hospital transfer. Interview with LK providers and employees similar to a New York hospital quarterly transfer revenue that gives an account of SBAR audits. Reporting of resident changes in condition and transfer rates. Do you have questions or concern? Thank you so much for listening. Thank you.